Hey everyone, this is Dr. James Nodler with CCRM in Houston, Texas. And I'm here today with my wife, Dr. Abby Nodler, who is a psychiatrist. And we're going to be talking about loss. And I think that this is a really great topic for fertility patients, especially during COVID, because there's a lot of different types of loss going on. So, obviously for a fertility patient, loss can be that a fertility treatment like a Clomid or an IVF cycle didn't work, or loss could also be a miscarriage, or an embryo tested as genetically abnormal. But in this time of COVID, what we're seeing as well as loss could be loss of a job, or maybe a loved one got sick or something like that. So, I had a couple questions for other Dr. Nodler. And so, Dr. Nodler, what are some ways that we can maybe recognize loss in our patients and help them through this time?
Yeah, so I think the first thing to think about, right, and I think about as a psychiatrist, is that loss is sort of part of the process of seeking fertility treatment. And the loss of being able to conceive on your own or as a couple, something that we can procreate together and create a baby together, it does feel oftentimes like a sense of loss. And that's something that I think is a good mindset for providers to have when patients are coming in, is that that's sort of ingrained in the experience for some people, not all, but some.
Yeah, and so I know for example, for my patients, I usually tell them, my advice is usually try to have a network, try to have a web of people that you can deal with. And one thing that I usually say is, just trying to talk to your spouse about this loss, maybe that's not enough because the spouse is also going through the same loss. So broadening that web, and that's tough in the fertility game because a lot of people, they want to be private about it and they don't want to talk about it. But I think personally that's really important is I call it loading the boat and getting your friends and family involved. What do you think about that?
Yeah, and the other thing to think about is that if we experience the same loss, like as a couple we experience the same loss, I could deal with loss very differently than he did, even if it's a shared loss. So if there's a loss of income or a family member who's sick, or if it's an infertility type loss, that each person experiences that loss and processes that loss and reacts to that loss very differently. So if we happen to be a match in sort of feeling the same way and experiencing the same intensity of emotions, then it can be very effective to rely on your partner. If maybe there's a mismatch, it can actually cause some problems. So in that sense, it might be extra important to reach out to people who can support you and your partner in processing that loss and managing it.
Yeah, and so I think, talking through things with your doctor can also be helpful,
Yeah.
whether that's your REI doctor or maybe a therapist. And so, I think it maybe helps some of our patients to get some insight as to if it's a fertility loss, why that loss happened. And so I know that we are all happy to talk through things like that. And I do, tell people that working with therapists is helpful, whether that's a social worker or maybe even a clergy member or something
Right.
like that. What outside of kind of loading the boat and talking to people, are there any other coping strategies that patients can use for loss?
Yeah, we look at, when you look at actually losing a pregnancy, so you are able to become pregnant and you have a miscarriage, oftentimes even pre-pregnancy, even more so oftentimes during pregnancy, we sort of attach lots of thoughts and feelings, hopes and dreams for this unborn child. And if the pregnancy is lost, some things that can be very helpful is being able to memorialize that pregnancy in some way, whether it's a donation to your favorite charity, or a stone in the backyard, or something to remember that experience with, and sort of have it be a place where you can go and think about it and put it into a more tangible experience, because it lives in the emotional world right after a miscarriage, and it becomes part of your narrative and your partner's narrative, and actually it becomes a part of the future children's narrative in your family. So it's important to sort of sit with it and process it and reach out and get support, whether that's through friends and families, your team at CCRM, or a therapist or a psychiatrist.
Awesome. Well, thank you so much, Dr. Nodler. Look forward to more videos from us, and we would be happy to see you either in person or via telemedicine visits. So Look us up at ccrm.com and take care. Bye-bye.